HIV positive. My whole world came to a standstill. I couldn't believe it that I'm HIV positive. How can something like this happen to me? And you know what? And when I came out of that tent, and the girls asked me, Debbie, how was your results? What was your results? I said, I'm negative. I lied. I said, I'm negative because I didn't want people to know. And you know what happened 3 days later? I had a stroke in my sleep because I never told anyone. I suffered in silence. And it's still very painful until today because, you know what? It's a struggle that I have to go through alone. And after after I had my stroke and they took me for counseling to the sisters, I thought there's no life after this for me anymore. I will never find someone to love me because I'm HIV positive. I will never find a man that will be able to love me because of my status. And you know what? I was so wrong. And a few months after that, I started getting back pains and I started coughing. It was a constant cough and night sweats, and I never took note of it because I didn't want people to know what was I going through. And then I waited until the last minute, and when they took me to the sisters, I found out that I had TB. And I started my treatment, my 6-month treatment. And I'm telling you guys, even if you have TB and you take your treatment every day for that 6 months, there is still a chance for you. And people at DCS, they do care.
We are proud to be South Africans. For the fact that our Deputy President has taken his time to come and be here with you. I've traveled the world, I've been everywhere. I've never seen ministers or presidents or government people visiting offenders, because they will always say they have offended the societies and they have to be there in jail. But we in South Africa, we call this place Correctional Services. And indeed, we need to congratulate our government, our leaders, to say they are indeed leading from the front. We are proud of you.
HIV is a serious health threat for inmate population in many countries, including South Africa, where the dual epidemic of HIV and AIDS and TB co-infection presents significant challenges for health authorities. Inmates remain part of the broader community, and the health threat of TB and HIV within and outside correctional facilities demands coordinated action. Overcrowding, poor conditions of confinement, and inadequate medical services exacerbate negative health impacts and complicate the provision of health care services and programs, resulting in increasing morbidity and mortality.
The first area which we identified as a special problem is the high prevalence of TB in the mines. The prevalence rate is 7 times higher than in the general population because of the triplets of TB, HIV, AIDS, and silicosis, silica dust. So our mines need special attention. The second area which we think needed special attention is the issue of TB among children. It needs special attention, Deputy President, because it's difficult to diagnose TB in a child. Very difficult, it's challenging. Doctors are struggling, they are trying their best, but it's a big struggle. Part of the third area, which is what brought us here today, is TB in correctional services, which is also exceptionally high. In fact, it looks like we are starting to discover that in correctional services, the prevalence rate might even be higher than that which we know to be in the mines. So these are the 3 areas which on this World TB Day, we want to do something about.
Our country faces a big challenge of HIV and TB, with the highest number of people living with HIV. We also have the 3rd highest rate of TB infections in the entire world. This is because TB is an opportunistic infection that thrives in the presence of weakened immune system, and in most cases, where the immune system is weakened by HIV. Reflecting this mutual dependence between HIV and TB, our national response to HIV and AIDS pandemic is thus targeted at TB, especially because, unlike HIV, TB is curable. In a manner of speaking, we have left no facet of life untouched, which is why we have today opted to join the correctional services communities to entrench the anti-stigma message that HIV and TB do not discriminate, and therefore our responses should not discriminate as well. As such, our HIV and TB campaign and response is all-embracing and respects the rights and dignity of all to have access to quality health services. We have to fight this scourge together to attain the vision of zero new infections, zero discrimination, zero AIDS-related deaths, and zero new vertical transmissions. Today, we are handing over 6 additional GeneXpert machines to the Department of Correctional Services. These will be distributed among the 6 correctional services regions. We do this because our country believes in a correctional service, a service that envisions the return of rehabilitated offenders to society as healthy and responsible community members. To this end, we should consistently encourage each other, all of us, to make it our second nature to continue testing annually so that we may be treated early in the event of testing positive.